I think I am live. I am going to buffer for a moment to make sure that my team can let me know if I'm on, but hello and good afternoon, everyone, and thank you for joining me. I'm Liz. I am Senator McMorrow's Director of Constituent Services and District Outreach. I am covering for her today. As many of you saw last week, she and her husband welcomed little baby Noah into the world. So we're super excited about our new addition, and we're dedicated to keeping these coffee hours rolling while she's away on maternity leave to make sure our office is readily accessible and available as we always are. So today we're doing a coffee hour to a similar format that we did back in October about the Ask the Clerk, where we had experts come in and answer questions about the topic. And so we're doing that again today, but about the COVID-19 vaccine. And so we are lucky to bring two experts from Oakland County Health and Human Services, Leanne Stafford, the health officer, and Dr. Russell Faust, the medical director. So they're here with me now, so I'm going to bring them onto the screen. Hello, thank you.
Hello.
Hello, you guys are on. Yeah, so if you guys want to introduce yourselves and I guess your role in Oakland County.
Go ahead, Leanne.
Oh, I think you're muted.
You're muted.
Oh, there we go. common saying now, right? You're muted. Hi, I'm Leanne Stafford. I am the health officer here at the Oakland County Health Division.
And I'm Dr. Russell Faust. I'm the medical director here at Oakland County Health. And I think Liz had already introduced us.
Yeah. Yeah, well, I just want to say thank you again for being here with us today. And I'm really excited about the opportunity to bring information from experts right to our constituents. So for the first part of this coffee hour, I wanted to just dive into the big topic of the COVID-19 vaccine. And one of those questions, I think, the topics that people have is the makeup of the vaccine and how it helps our body either prevent the infection of the coronavirus or fight off the coronavirus.
And I'm happy to take that one. But
yeah.
I'll warn you, I'm a tech nerd. If I start to geek out too much, just stop me, cut me off. But I'm pretty excited about these vaccines, especially these mRNA vaccines, for many reasons. This is a huge advance in medical science. So it's a little technical, but when cells in our body want to make a protein, basically the DNA that encodes for that protein is translated into a message RNA, mRNA, and then that's taken out to the cytoplasm where it is translated into protein. Okay. So instead of injecting people with viral protein, or like is used in some other vaccines, the entire virus, whether it's been attenuated or killed, they decided to try to use just an mRNA that is the message for the spike protein. And as it turns out, it's a great choice for an antigen or a vaccine. And so what they do is they take that, they synthesize up the message RNA, they encapsulate it into some lipids, and then they use that as the vaccine. And what happens is through some some biochemical magic, those lipids around the message are taken up by cells in your arm when you get the vaccine. When you get the shot, they're taken up, and it releases the message RNA for the spike protein into the cytoplasm, and your cell's protein synthesis mechanism starts to make spike protein, and it spits out spike protein. And your immune system recognizes that as abnormal, as foreign, a foreign invader. And it creates quite an immune response. It's a very, very strong immune response, much stronger than most vaccines, in fact. And you'll hear, people talk about kind of the reactions, and we can talk about some of those in a little bit. But it's a great method, and I'm looking forward to a time when most of our vaccines are transitioned into mRNA vaccines because they're just so much more effective. They're much safer overall, and they're fairly inexpensive and fast to make. And we could talk about kind of the speed of making this vaccine too, if you like.
Yeah, I know a lot of people had concerns about how fast this was. They call it fast tracked, but how it got to approval. So if you want to touch on like why it was approved so quickly.
Well, it wasn't the approval so much that was impressive, was the ability to develop, the vaccine, and the science behind that and the laboratory work behind that usually takes a very long time. The previous record for developing a vaccine was 4 years. Before that, it was routinely 10 years to develop a vaccine. And frankly, we just didn't have that kind of time at the rate the virus was spreading. We were very fortunate in that many companies around the world have been working on this mRNA vaccine method. And they had worked it up for previously epidemic or pandemic SARS, MERS, and Ebola. So they'd already worked on the method for those vaccines. And we were fortunate in that they were able to just remove kind of the mRNA sequence kind of as a cartridge and replace it with SARS-CoV-2 spike protein message. And really they got it done in less than 12 months.
Wow.
So what really took most of that time was moving through safely and effectively moving through the clinical trials, phase 1, phase 2, phase 3, with tens of thousands of people enrolled, and making sure it was safe, and then making sure it was effective. It's effective in reducing the risk of infection for coronavirus, COVID-19. It's effective compared to those that got the placebo at greater than 90%.
Yeah,
that's spectacular.
Yeah,
on a usual year, the flu shot that we get, if we get 20 or 25% effect, we're jumping up and down. That's cause for celebration. 95% is unheard of for a vaccine. So this is all good.
Awesome. Thank you. So on to the next topic about, I guess, scheduling and prioritization. So how does, I put in my notes that 2 points, but I think it can go into one. So how does the vaccine come from say a Pfizer lab to the arm of an Oakland County resident? What is the process for that, and how, I guess, do we determine who is eligible for that vaccine?
I can do that. So I'm not sure where exactly our vaccine comes from. Pfizer actually has, plants in Michigan, so that's good news. I suspect it comes from there. But we receive it here at Oakland County Health. Let's talk about the Pfizer vaccine because it's logistically a little more challenging, but we take that. When we receive it, it goes straight into our minus 80 degrees Fahrenheit freezer. And when we know how many doses we will receive for next week, for example, we're scheduling people through the week so that we get 100% of that vaccine scheduled and into somebody's arm by the end of the week. From the freezer on the morning of a vaccine clinic, it's brought out, it's thawed, it's distributed to that site, the vaccination clinic, and we have folks diluting that out from the vial into the syringes, and then out to the vaccinators, out to the nurses that are stabbing arms.
Stabbing arms. That's a fun way to put it.
Well, we're all about stabbing arms right now.
Yeah. I know there was a joke about calling it the Fauci ouchie. I like that one too.
I like it.
Yeah. Okay, so I think we can move into some questions now. One is from Jan from Rochester. They ask, I know it'll take 2 weeks after the second vaccine to have 95% immunity. Their question is, once they have the immunity, is it safe to be with a friend who has also had both vaccines? Are masks still required or encouraged if both people have the vaccine?
I don't want to monopolize this whole thing, but I do want to address this. This is the most common question we have. People are like, well, I got vaccinated, I'm done. Why do I need to wear a mask? Why do I need to maintain distance and all that? And there's a handful of reasons. You still need to mask, still need to distance, still need to avoid crowds. Okay, and let me just run down those. First off, it takes a while to establish full effect from the vaccine. We can measure an effect at 2 to 3 weeks out, but it takes a while, even longer than that, for your immune system to really get revved up and provide full immunity against whatever you're being vaccinated against. So that's the first reason. The second one is, no vaccines are 100% effective, okay? None provide 100% protection. 90 to 95%, that's spectacular, but it's still not 100%. So we still need to wear a mask to protect those around us and ourselves. Those who have been vaccinated, and this is the real question, people who have been vaccinated may be asymptomatic spreaders, and we just don't know enough about that yet. CDC is still working on that. We're collecting data, but we don't have the true answer yet. And that's a real question, a real risk. We still need to protect those that can't be vaccinated. There's a number of people out there that, for whatever reason, because of their potential risk or reaction to the vaccine, cannot be vaccinated, and they need to be protected. It's going to be a long while, I think, before everybody who wants to be vaccinated will be vaccinated. We have a limited supply. And finally, and this is key, this is important, masks protect us against all of the variants, not just the ones that we're being vaccinated against. It's an RNA virus. RNA viruses are notorious for mutating, which SARS-CoV-2 is doing. And, there's some question whether a couple of the newer variants maybe aren't as affected by the vaccine immunity. So masks just make sense. We're protected against all variants with the masks. So continue to mask, continue to maintain distance, continue to avoid crowds.
Okay. The next question we have, two people wrote in about this, Marianne from Royal Oak and James. They wanted to know, so they've signed up for the Save My spot with Oakland County, but they were wondering if there was any follow-up or if is any way to know where they were in line.
Yeah, so this has been a common question that we have received. And so, we have closer to 400,000 entries in our Save Your Spot program. So what we are doing is, going through that list based on priority. And, we're following the 1A and the 1B priority that the state and the CDC has put forward. So there's no way to check what your number is in line, because the one piece to remember is, as we're going through, if I tell you that, Dr. Faust, you're 35,134 right in the line. We have had people that have registered that maybe don't fit the 1A or 1B priority. And so what we're doing is we're looking at that list based on priority, and then we send you an invitation based on, your email address. If you weren't able to provide an email address, we actually will call you. And it's basically an invitation at that point to register for a vaccine. And so kind of the process, just to kind of keep going through that, is we set our schedules once we're notified of the supply we're going to receive for the week. And then we will push out those invitations. We generally give 48 hours turnaround time for people to register for a spot. But there have been occasions where if you haven't opened the email, we leave those open for the week so that people have time to check their emails and be able to register for an event that week.
Okay. And I know this is a question James also had, is there vaccination opportunities for those individuals who are direct care workers or providers for their elderly parents that not necessarily are a direct care worker in their job title? Like, where would they fall in the categories?
So they would be considered like a caregiver. And so
Okay.
they would be included in the 1A and the 1B priority. And so if they're registered as such in Save Your Spot, we will follow up with them when it's time for them to receive their invitation.
Okay. So I know we touched base on like the flu shot that we get every year. So in our future with the COVID-19 vaccine, what is our future look like with that? Is it a yearly immunization that we need to get, or once we have it, are we set?
First off, I wish I knew the answer to that.
Yeah. Well, what do we know?
On the optimistic side, we are seeing a really strong response to this vaccine, so that's good news. And in fact, the early data that we have suggests that the vaccine actually provides better immunity than if you were to get infected with COVID-19. Okay, so that's good news. Right now, we don't really know how long that's going to last. That is, we've been vaccinating people with these vaccines for what, 2 months, maybe? So we won't really know the answer until we're out a ways, and there's just no way to predict. Well, there's a way to predict. It's a stronger response than the so-called natural immunity from being COVID-19 infected, but we're not going to know. Of a greater concern is that as an RNA virus, it continues to mutate. And so there may be variants that may be resistant to the vaccine effect, okay? And there's some suggestion that the South African variant is a little bit less responsive to the vaccine than the other variants. So that may be a possibility. If that were to happen, and I think Moderna and Pfizer are working on this right now, is working on a generation 2 vaccine to follow up. And that may be the case. I don't think so right now. I don't think it's going to be like the flu, because influenza mutates so rapidly that in the span of a year, there's 1,000 variants. And what the CDC does every year is they select, or World Health Organization, they select like 4 of the worst and make a vaccine against that. SARS-CoV-2 isn't mutating nearly that rapidly. So I think there's more stability. If I had to predict, we might need a booster in 5 years, but so far so good. The real key, the solution, is to get as many people vaccinated as soon as possible, because that'll put a stop to the variants, the mutation.
Yeah, I am. I think I'm level 2 in the prioritization of vaccination. But every time I see those little cards with people getting vaccinated, I heart it on Facebook, and I just get really excited. One step closer to a normal world. So Kevin on Facebook asks, will the vaccine supply, I guess, to Oakland County and Michigan increase with the approval of the Johnson & Johnson vaccine?
It's already increasing, even before the Johnson & Johnson approval. And there's another one, I think, that's being reviewed in a couple of days, Janssen, whoever that is. So that we have more likely coming online over time. But even so, even short of the additional approvals, Pfizer and Moderna are doing everything they can to increase supply. It's not just us, it's the whole planet they're supplying, but they're working shifts around the clock in increasing supply. So whereas, 5 weeks ago, we received fewer than 2,000 doses a week. Leanne, how many did we receive this week?
This week we received for first and second doses a little over 11,000. So
even without Johnson & Johnson, we're getting more all the time. And so I think things are looking up. There is a light at the end of the tunnel.
Yeah. Okay, Emily on Facebook asks, the Oakland County Health Department has closed the get in line option. What should I do now? I am an elementary school teacher.
So our Save Your Spot link is still open. And I'm wondering if maybe that individual received an invitation to actually get an appointment and maybe that link expired. I'm not exactly sure. But if that's the case, we will follow up again. You will receive another invitation to be able to register for that vaccine. If you weren't able to, if you open the email late when it expires, you'll get another opportunity and you'll be notified when it's time to register or to actually register for the vaccine through the invitation.
Okay, thank you. One of the other things I think it's getting more increasingly popular is the 2 masks. The requirement or the recommendation for that, and why is that? I guess I think I know it's about the new variants, but I guess what do we know about the new variants in Michigan and the double masking?
It's a great question, and I'm glad somebody brought that up. No, really. So for variants to really spread and kind of replace the old variants, for them to do that, those mutations infer more rapid transmission, and that's what's happening. And so most of the new variants are more easily transmitted. They're more infectious. They don't make you any sicker. It's not more severe disease. They don't have a greater fatality rate yet, fortunately, but they are transmitted more easily, and so they spread more rapidly. There are many reasons for that, and I'd be happy to geek out about all the cell bio reasons, but the way you prevent that is to really make sure that there are no respiratory droplets being transmitted. All of these are transmitted by respiratory droplets. None so far are transmitted by surfaces. It's all respiratory droplet, person to person. And that's why the mask and the distance in the crowds, that's what that's all about. So one of the ways you can decrease respiratory droplets being transmitted, being spewed forth, is to wear a tighter mask. So, for example, an N95, that's a pretty tight mask. Or you just wear 2 masks. And so those respiratory droplets are even less likely to make it through all those little channels in the fabric and get out there. And so that's especially in the context of these new, more easily transmitted, variants. The double masking is a great idea, and actually many of us at County Health have been double masking for a while, for a lot of reasons, but we've been doing that since March, April, May.
Oh. Yeah, I have a fabric one, and then I have my little surgical one that I wear. Okay, another question we had is from Mary. When will those who work in dental offices receive a vaccine opportunity? They were worried about their high patient contact.
So actually, they're part of our 1A priority, and so they have already started to be invited for the vaccine. What we do is when we have appointments available, we take a percentage of each of those groups that are priority and try to invite multiple people or a percentage to each of our events. So I know I have heard from dental assistants and dentists that they have actually received the vaccine. So I know those are mixed in with the healthcare group that we're inviting. And so again, hopefully you're signed up for, and if you're not, make sure you get on the Save Your Spot, because healthcare is 1A, which is, a top priority.
Okay, and the next question we have is from Jill. They ask, will those of us who are 65 and older who have yet to receive the vaccine be assured the vaccine before, I guess, the new wave? Or will you, so I guess what she's asking is, do you finish one wave and move on to the other? Or do you, get the majority of the first wave and then open it up once there's more availability?
So generally what the state has been doing is it does overlap some. So, right, so it started with 1A, we got through, a percentage of that, and then they moved on to the 1B category and then included the 65 and over in that group. So at Oakland County, we were really still focusing on healthcare at that point. And so that's why as we have moved forward, we try to take a percentage of those, high priority, which is really, that the healthcare, right, EMS, fire, law enforcement, teachers, childcare, and 65 and over at this time, and really have a percentage of all of those invited to each of these outreaches that we have, or vaccine events that we have.
Okay. And then I have one more question, and you guys can, discuss any topics that you think are important for us to go over. But I know people are there's a lot of people that are very similar to my situation, where we are fortunate enough to be able to work from home for the foreseeable future. And we're not, I don't have any pre-existing conditions, and I'm not 65. When do you think a likely timeline would be for people like me to get vaccinated?
Well, I'll start, and then I'll if Dr. Faust has anything to add. It really depends on the vaccine, and when the quantity of vaccine that we receive. We have a significant number of 65 and over individuals in Oakland County that we still are focusing on and working through as these events occur. Our hospital systems are doing the same. They're going through their patients that meet that, priority group that the state has put together at this point, and inviting them for appointments. So, the next phase, or, when we get to more of the general pop, really does depend on the number of vaccines that we receive here in Oakland County, and continue to receive at the state.
Yeah, I think it's really that simple. We just need more vaccine. And, fortunately, we're getting more vaccine all the time, but it's all about the quantity of vaccine we receive.
Yeah. All right. Well, those are all the questions that I have. Is there any, closing remarks that you guys would like to talk about, or anything that I may have missed?
Let me just remind people, it's not too late to get a flu shot.
Oh, yep. October, so.
I know everybody, is focused on COVID-19. The fact is, if you're not vaccinated for COVID-19, either way, get a flu shot. If you get co-infected with COVID-19 and influenza, regardless of what age bracket you're in, it doubles your risk of mortality. So just get a flu shot while you're waiting to get your COVID-19 shot.
Yeah. Protect yourself.
Yeah, and that was the last thing I want to really emphasize. It's important that we have people register on Save Your Spot. We are, working through those as we receive more vaccine. We're pushing it out. Our goal is that within 7 days, we are allocating at least 90%. Our goal is, to push all 100% of vaccine out as we receive it within 7 days. We do obviously take off the top those second doses, because we want to have people fully vaccinated. And then we offer those appointments throughout the next 7 days. We're focusing on, trying to do, different locations throughout the county. We have drive-through locations. We have walk-in indoor locations. We're doing large scale, smaller scale. The goal is just to get that vaccine out as quick as possible. We're doing weekend events for people that are working, and then we even have evening hours. So I know it's hard for people to hear, be patient, but I promise we are continuing to work through our list and, getting to those that are interested in receiving the vaccine.
And one little question is, how often do you guys update the data on the numbers on Oakland County's website?
So they're updated. Yeah, they're actually updated weekly. Next Monday will be updated for the following week. So then the data will be updated.
Okay.
Finally, let me just say,
yes.
Wear a mask.
Wear a mask.
Keep your distance. Avoid indoor crowds.
Yep. All right. Well, I just want to say thank you again for joining us, and I'll be sending this out with a lot of information to our e-newsletter as well. So if you didn't get your answer question there or here today, we will work to answer them later. Again, thank you guys so much for joining. I feel like this was pretty awesome to do.
Thanks.
All right. Thank you.